It's Today in Putnam County with Shan Stout.
Hi everyone, welcome to today's episode of Today in Putnam County. I'm Shan Stout and we have two fabulous guests with us today from the Cookeville Regional Medical Center Foundation. I have John Bell and Amanda Scott. Hi guys.
Hey,
hello.
Thank you.
Thank you so much for coming on the show, and we are here for a very specific reason, but to also talk about an important factor of your jobs. So John, we recently had the very successful Pink Gala, and hundreds of people show up to this every year, to the point that you don't even really have to market it anymore. You probably are the anti-marketing because people want a table so very early. Tell us a little bit about how the Pink Gala got started. What is the Pink Gala for any of our viewing or listening audience
Sure.
that may not know, et cetera, et cetera. We want to hear, spill all the tea.
Yeah, love it. So the Pink Gala is in its 18th year this past year. It has been a long evolution, but its purpose is primarily to help us offer free mammograms to ladies that would otherwise not be able to afford that service. And so it started with that simple mission of expanding access to mammograms, and has grown from there. We've had some of our committee members involved for all 18 years, so we've
Wow.
had a long commitment out of some folks, and we've got a lot of wonderful new committee members as well. So it's just a wonderful event. We feel like a very elegant event and a very successful event. And the community has thankfully been very supportive of that idea of helping us expand access to screenings for neighbors in need.
Well, I think everyone, I don't know of a single person that has not been affected by breast cancer. So prevention is so very important. And I appreciate what you're doing, but you may not know this. The other night, I attended, and I ran into a lady in the lobby who said she was here for the first time.
Yeah.
And she was coming as a guest to someone who had purchased a table. And she said, nobody knows this about me, but she goes, when I lost my job, I lost my insurance. I could not get a mammogram. And she said, my family had a long history of breast cancer. So
Sure.
she was really concerned. And because of the services you guys offered, she said there was no lapse, in that mammogram. And she said, I'm happy to be here tonight just to say thank you. And I thought, how sweet is that she kind of hunted down somebody with a place for her to be able to be there and support y'all. But this mission is so important. Now, John, give us your full title, and you wear multiple hats, so you can make this any which way you want it to be.
All of us in nonprofit wear many hats, but Executive Director of CRMC Foundation.
Now, Amanda, let's go ahead and cover all the titles while we're...
Amanda Scott, and I am the event coordinator.
And I feel like everyone knows you, but we're reaching a broader audience than just our little circle of the world here.
Yes.
So for anyone that's listening and is curious, the Pink Gala doesn't just happen. It's not just a fun party that is beautiful. If anyone has not looked up the photos and the videos online, they definitely need to follow your social media and see what's going on there. It's an extraordinary event. We see a lot of fundraising events here across the Upper Cumberland, but the Pink Gala, I have to say, everyone, it's just no contest. I'm not even offending anyone when I say the Pink Gala is the most beautiful, well-done event that we see here in Middle Tennessee. So there's a lot that goes into that. You have these curated artists that come in. They have a vision. So let's recognize them for a moment.
Yeah, I'd love Amanda to talk about the committee a little bit, but I have to brag on Amanda. This event is becoming a year-long process, and she does a wonderful job leading our committee and engaging with them and making sure our sponsors are getting what they want out of the event as well. So it's a lot. And I want to thank Amanda for taking on the challenge.
So as you said, we have a committee. It's called the Pink Gala Committee. That committee is made up of hospital staff. Some of the donors are on that committee. We have a lot of our sponsors that have different family members that are involved with the committee. There is no way that we could pull this off without our Pink Gala Committee. And then I have to throw out our event designer is Dawson Davidson. He is from Cookeville. Him and Mark O'Brien with the tulip tree helped design this year's event. I want to say this is his fourth
fourth
year,
tree, yeah.
fourth year with the tulip tree.
And you could tell, Dawson's vision has a particular flair to it, and it is more is more.
Yes, yes.
And it really is an extraordinary, we just saw the blueprint of the potential plan, his floor plan, and I was like, oh man, this is going to be something to see.
Right.
And it was.
It was gorgeous. And like John had said, this event, I've been with the hospital 23 years. I've been at the foundation for 15. And so this event has grew to, it's an all year, getting the donors and the volunteers and getting everything lined up. So like you said, I have to say that I do think this is the event of the Upper Cumberland. Because of it, last year 600 patients received free mammograms.
And that's life-saving care right there. That preventative measure is so important.
Absolutely.
That early diagnosis, and I just know, even after my mammogram, just the relief of knowing everything's fine. I think the mental health is also beneficial to your health in general.
Right.
So it's just important across the board. Now, let's talk about, it took 3 days, and I managed the convention center, and you guys moved to the convention center this year. But I want to talk about, let's give some props to Leslie Town Center. You've had it there for a long time. Kat Molina is a good friend of mine, and she manages Leslie Town Center. This year she got to attend the Pink Gala for the first time without working. And she goes, Stan, I feel so sorry for you, but I'm having the best time. She was just having the time of her life, and she looked beautiful, and they were having so much fun. But you guys are growing, so you had to find a bigger venue, and ours is just a little bigger than Leslie Town Center. So you moved to the convention center this year. You worked on it for 3 days solid, from the ceiling to the floor, and there was a lot going on. You had beautiful silk draped curtains from the ceiling. Chinese lanterns were covering the ceiling, and then you're working your way down these tall floral arrangements. You have trees in there. Let's just be clear, there are trees. It was a beautiful floral forest that was going on, and then of course the pink theme, which is just, it was just extraordinary.
Well, thank you.
Absolutely, yes. We are still digging out from it.
Oh, I'm sure. I'm sure.
So excited.
So I want, I had some people reach out because we were at the convention center this year, so I got a lot of phone calls about the Pink Gala and it coming, and how do they get tickets? And I said, I'm so sorry, we're sold out on that one. They don't have any more tickets. And they said, well, we never get any invitations, and they were kind of hurt about it. And so I was just kind of putting those feelings to bed and saying, listen, guys, it's nothing personal. I don't get an invitation. No one gets an invitation because they're pre-selling out this event. You're selling out tables even the night of your event for the next year. So let's talk about that, so that anyone across the Upper Cumberland who feels like I should have received an invite. You guys do not have to market this event anymore. So we don't want anyone to feel bad, but they are going to have to do a little bit of proactive, get your foot in the door on your own to be able to get a table.
It's taken a long time to get the event to this point.
And like you said, 18 years.
Yes. Yeah, but we are grateful that we're now in the position where we don't have to actively solicit for table sponsorships. That those folks come to us for the most part, and we've already sold nearly half of the tables for next year. So it does move very, very quickly. So we're grateful for that. We're grateful to the community.
It's a wonderful problem to have. It is. It is.
And part of that, it's a unique event. It's beautiful, and part of that's just we have so many people that really want to specifically support that particular mission. And on the back end of things throughout the year, we're helping women access these mammograms year round, and it's expanded from there beyond mammograms to also include cancer screenings for lung cancer and other specific types of cancer, and it's assisting cancer patients as well. So we have a cancer patient assistance fund, and we help about 1,100 cancer patients a year through that fund as well. So the gala, as it has succeeded, has benefited more and more patient groups that need help.
Now let's talk about the live auction on the floor during the event for the pink robes, because I think that is very special. I don't know who came up with the idea, But that's a very visual thing that someone, that audience member can look at that item and say, I'm going to donate this amount of money for this many robes. And if you are a female and you have had a mammogram, you understand it feels very vulnerable. Sometimes that's a barrier to people wanting to have a mammogram,
Okay.
Yeah.
Yes, the robes really were the idea of the staff in the Women's Center, who consistently gave us feedback that exactly what you say. Women felt uncomfortable getting these mammograms. It was very exposing. It was not an experience they particularly enjoyed.
Yes.
And so we thought that the robes would just make it a little more uplifting, a little more comfortable, put you at ease, just a little more of a spa treatment than those medical robes that you had before that. And we tested it a few years ago, and donors overwhelmingly said, yes, we want to know specifically what we're doing with this money. This is a great way. And for many of the ladies in the room were like, well, I'm going to benefit from this when I go get my mammogram.
Definitely.
Why would we not do this? And those sponsors are recognized in the Women's Center as well as supporting that robe initiative because folks really do appreciate it.
Well, thank them for me, because I know, I've had mammograms for a long time now. And when they started the pink robes, when you get your mammogram, that was comforting. It was like, oh, this feels like they see me, they appreciate, this is something that it just was thoughtful. And it did feel more like a spa situation. It had that vibe to it. And I thought, oh my gosh, this is so much nicer than the hospital gown, that you used to be stuck. And, hospital staff sometimes get desensitized because they see people in their worst scenario all day long. So they don't care. They don't really see you that way. But you walking in your street clothes from work to get your mammogram during your lunch break, you feel very vulnerable. And so the fact that awareness is there, that the staff thought of that and listened is really, really nice. And I think that speaks well to our local hospital. Cookeville Regional, the staff live here. Your friends and neighbors are who you're treating, And across the Upper Cumberland, people are driving in here to receive care, but those are still people that you're connected with,
Yeah, our CEO, Buffy Key, says it all the time. It's our people taking care of our people.
Yes.
And improving that patient experience, I think, is really a priority for all of us, because we're all going to be patients at some point.
Right.
And we're in a unique position that the hospital is still community-owned, community-focused, and we can do that. We can have a charitable foundation. We can improve the situation for robes. So I'm grateful to Cookeville Regional for allowing us to expand on that and allowing donors to have a more meaningful impact on the patient experience.
So how important is the Pink Gala? We're going to wrap up this first portion of today's interview. You're kind of putting a lot of your eggs in this one basket. This event has to go well. It needs to be well supported. Your silent auction, the support from the community and your local businesses. If you want to talk about that a little, because maybe these small businesses who are donating items for auction may not understand, but every single thing that is donated, contributed, it all matters.
Right. So we do a live auction, we do a silent auction, and then we've started something new that's called the experiences. So we do reach out to local shops for donations, and what is great about that, we have a different variety of baskets for females. We have stuff for men, so even some stuff for kids. So it's just a wide range on that auction, which did very well this year. It goes very well.
Now, even though you have a committee, you have the foundation, you have your volunteers, you always need help. And so there may be some businesses that did not get reached out to. Again, don't get your feelings hurt, because this is a small amount of people trying to reach a mass amount of businesses. So if there is someone listening who owns a business or someone who wants to contribute in some way and say they've missed this year, but they'd like to do something for next year, or they just want to contribute something to help the foundation, what would you tell them to do?
We want your involvement, whether it's with the Pink Gala or another initiative that helps us assist patients. We have a number of events that are specifically for our Cancer Patient Assistance Fund. The Gala helps with that. Our 5K race, Summer Splash 5K, coming up this summer. That's a family-oriented event, goes specifically for the Cancer Fund. We have a golf tournament in memory of Ann Cameron that specifically goes to the Cancer Fund. So there's a number of ways you can get involved. If it's not the gala, maybe it's a golf tournament, maybe it's a 5K race, maybe you just want to help out with a specific thing like robes. There's a way for you to help. I would encourage you to call us at 783-2003 or visit us online, cookevilleregionalcharity.org.
John, Amanda, I appreciate your time today. And when we come back, we're going to talk about the important work of the foundation a little bit more, the benefits of supporting your local hospital, and all the things that Cookeville Regional does to be able to give back for the community. And don't go away. You're listening to Today in Putnam County. I'm Shan Stout, and we will see you right back here after this break.
We're back with Today in Putnam County with Shan Stout.
Welcome back to Today in Putnam County, and we have been talking all things pink today. It has been the Pink Gala and all the success of this wonderful fundraising arm for the Cookeville Regional Medical Foundation. So we've been talking to John Bell, Amanda Scott, and all the hard work that goes behind it. We have recognized the designers behind the event. We have talked about the volunteers behind it. And of course, the foundation is the heart of it all year long. Amanda, you are the event coordinator for this. What an outstanding role. You have really, you've been lovely to work with. I'm just going to say that right out of the gate. And, you know, I deal with at least 4 event coordinators a week that are all doing very important work and raising money for very important causes and everything. You've just been lovely. I don't dread when your name comes up on my phone, and I consider that's a big compliment for a person. And I don't know that, you know, the mayor may not say that when my name comes on his phone. He's like, oh no, it's Shan again. What does she want? But you've just been lovely to work with. And I know that you have important work to do. This has value that goes all year long, but planning the event goes all year long. So we touched on that earlier, but the foundation doesn't just do the one thing. And John, you were talking about the different things. But before we go into that, as we were off air, you shared a story, Amanda.
Yes.
A little extra piece behind the pink robes, which of course are those privacy robes that are given to patients to kind of help the experience be less vulnerable and just a little more empathetic to what they're going through.
Right. So after we did the robes at the OIC, Amanda Bain, who is the imaging director, reached out to John and with another great idea about a heater for the robes. So the robes were heated. So we were able to get that approved. We purchased that. So now not only are you getting the pink robe, it's heated.
And I've experienced that. It's just very comforting when you feel fragile, when you feel a little scared. You know, because sometimes you come for a mammogram and it's your annual checkup and you think no big deal, I'm fine. But then sometimes there's a lump or there's something abnormal or you just don't feel right. That level of anxiety really deserves a warm pink robe. And I'm going to say there have been times in my life where that was like, oh my goodness, this just because I'm already anxious, but this feels, you know, like a warm blanket. And the fact that you listen, I think it speaks well to Cookeville Regional that you're listening to patients, staff, outside comments, anything, and then you're weighing that opportunity and then moving forward. I mean, well done.
Thank you.
Thank you.
Thank you.
Okay, so speaking of well done, we've given Amanda all the props for the great event that just raised thousands of dollars for these mammograms and the pink robes and all those things that are so important. But you have different events throughout the year, John, that everyone can participate in. Let's talk about what's going on there.
Yes, Amanda's plate is always full with events, and we're normally juggling 2 or 3 of those at a time. Coming up this summer, we have several that happen all at once. We have the Summer Splash 5K in memory of Sarah Alice Baji. Many people run that race in honor of a loved one or in memory of a loved one who's been affected by cancer. We'll have several hundred runners. If you're not a serious runner, it's okay. We have many that walk that race, take their time with it. They'll walk with strollers, they'll walk with their family members. it's a good community event, and the route is fun. It goes right past the hospital, through Tennessee Tech, and back to the park.
And it's safe and mostly level. I mean,
It's mostly
not
level.
super challenging in a way. You know, like some routes are really like there's a big hill.
Yes. Well, and it's unique. It is called Summer Splash for a reason. We have folks that run this race in bathing suits and with inflatables because we have volunteers.
The photos are really fun to see later.
A lot of fun. You will get wet at this race. It's a lot of fun. We have 2 golf tournaments in the summer. One is specifically a fundraiser for cancer patients. That's the Ann Cameron Golf Tournament. And then the CRMC Golf Classic in August. So all year round, there's something going on. In the fall, we have a bike ride for families.
That's wonderful.
In Allgood. We have a tasting event for fine wine and even whiskeys in the fall as well. So there's something you can find to get involved.
Okay, I love that you said there's something you can find, because for some of our listening and viewing audience, maybe this is the first time they've heard about it and they go, oh my gosh, I didn't know there were all these things. How do they find out about them? What's the easiest path of least resistance?
The easiest way is to go to the website. That's cookevilleregionalcharity.org. If you've got questions, you can call us at 931-783-2003. If you're not an event person and you still want to help, we have a great way for you to donate. We have many restricted funds at the foundation to help different patient groups, Cancer Fund, a Heart Fund, a Pediatric Fund, and many other groups. So even small gifts can be restricted to help exactly where you want it to help. It all stays local, and it all goes to help patients right here in our community.
And I know that's a big question for people, because they say they don't want it to just help amass people across a region. They want to know that it is helping people in their community. And for people that have been touched by cancer in any way, it is a very personal way for them to choose how they want to have a tax write-off.
Yes.
I mean, let's just be clear. People have certain amounts of money that they want to have as a charitable donation. And that's a competitive market for you to say, please choose us, because there's plenty of ways people can give. So if you were talking to a person and saying, why was it important to choose the foundation to place your dollars, what would you tell them?
Yeah, the biggest is that it does stay local to help our neighbors. It doesn't go out of our community, it stays right here. Our donors also get to choose exactly how it's spent. So if they want to help cancer patients, they can do that. If they want to help pediatric patients, they can do that. We're also one of the very few nonprofits, because of our relationship with the hospital, that can say 100% of everything you give goes exactly where you want it to go. We don't take any percentage out for overhead. We don't take any percentage out for staff, because we're employed by the hospital. So all of your money that you're donating is helping neighbors in your community.
Well, I think that's wonderful to know that 100% of what you're giving is making a strategic impact in the direction you want it to land. That's really an innovative thought. Have you guys been doing that for a long time?
We have. That structure's been in place since the foundation was founded. And because of our relationships with providers, we can stretch those dollars pretty far. We know exactly where we can use them to have the biggest impact for patients. And so we think of it as a partnership between our donors, between the foundation, and then between the providers providing that care.
Well, we're talking about the charitable arm of Cookeville Regional. Let's talk about Cookeville Regional as a whole.
Yeah.
How important is it for us to have a local hospital? If we did not have a local hospital here, the Cookeville we know would not exist.
Would be vastly different.
Yes.
Yes.
So talk about, when you're talking about even economic development of a community, the first thing they want to know is, do you have a hospital? Is it a good hospital? Is it a hospital that's going to stay put? All of those things have to be checked off the list, and a lot of that first conversation with any industry coming in, any major, impact, they want to know before they bring in employees across the nation to plant them here, what is their quality of life going to look like? So that first driver, I know even the Chamber of Commerce, they will first take them to the hospital, show them the hospital, and then take them around the tour to the other things. But it starts with healthcare.
Absolutely. I mean, the economic impact of the hospital cannot be overstated for our region, not just for Cookeville and Putnam County, but for the entire region. because of that regional blueprint. We've got 16 or so counties that are sending patients our way, 65,000 patients a year at Cookeville Regional, 1,800 births a year occur at the hospital. But beyond those numbers, we're one of the few hospitals where local voice truly governs our decisions. We have a local board of directors at the hospital that controls the strategic direction of our hospital. And that's something a lot of communities our size just don't have.
That is
Those
very
decisions
rare.
are made somewhere far away by someone you don't know. Here it's made by folks living here in our community. And so this is a way for us, I think, to decide collectively as a community what direction we want to grow healthcare, what partnerships we would like to see the hospital develop, which it's done many, many times. The latest one is, of course, with Vanderbilt partnering for the Cancer Center. And so I know Buffy Key says all the time, our strategic plan long term is to take advantage of those partnerships and to build on strengths of some of those groups outside of our area to bring that strength here. So I feel good about the direction the hospital is moving in. I'm proud of our community and our community leaders for continuing to keep that voice local and to keep that control local.
And that is so important. That impact and that voice means a lot. And I know even, my role in tourism, you would think that doesn't overlap in the hospital realm, but it does every single
Sure.
day, because people who visit here oftentimes make a choice to move here. And the first thing they want to know is, how supportive is your hospital? How reputable is your hospital? Where is your hospital in location to where I'm wanting to live?
Yes.
And we have had to kind of downplay our footprint of wanting people to move here. Like we're trying to keep it, like you're the best kept secret, because we have such a solid platform that just a couple of years ago, we were like number 3, the top city in the nation where people were moving to. Like,
Wow.
It was insane. And so, Mayor Porter was like, everybody stop. We can't handle the infrastructure. We want to stay small in our way, because, we consider ourselves the hub here in the Upper Cumberland,
Sure.
but we don't want to be a Nashville. We don't want to be so big that our residents no longer want to live
Yes.
here, because they've moved here, they've grown up here for a reason. They like the size we are, they like the way we run, they like we have just the maximum amount of traffic they want to deal with. They don't want
Yeah.
any more. So I think that it speaks well to Cookeville Regional that we've had so many people move here from other states across the nation, because they feel so solid, because our footprint is very safe. It has a solid healthcare system.
Yes.
We have Tennessee Tech University. We have a wonderful downtown. We have all the natural elements with our state parks and waterfalls. We have a wonderful interstate system. If you've been anywhere in the other touching states,
We do.
I mean, like, you may say, well, our roads need work or this or that. You have obviously not been outside our state recently, because you will hit a pothole that's as deep as your
Yes, you
car.
will.
And I'm just very proud for where we live and the assets that we have, and appreciate that when there is even an emergency, with visitors, we know that we have a hospital not only so close, but so capable. And that makes us feel very, very good. And so I appreciate what you're doing. I appreciate that you're going outside the scope of just basic health care.
Yeah.
And you do, I hear you guys call it health caring. You do care for the whole patient. And I think that is important, to not just be seen as a number, not just be seen as a zip code, but that person, each individual patient experience is important to you. And my husband was in the hospital a few years ago, and we stayed there 38 days.
Oh boy.
And
That's
let
a
me
trip.
tell you, we knew every nurse by name, we knew every
Yeah.
doctor by name, they knew us by name, helped us outside of just basic life-saving care, saying, you look like you might want a blanket, would you like us to heat it for you? I was living in a recliner for a
Yeah.
month and 8 days. That's a long time to sit in a chair and try to not be crippled when you try to walk out of the room. So I appreciate, our experience there. The people were so kind.
Good.
And so confident that, my husband was not going to make it. So literally saved his life. Appreciate it beyond words. But I would just encourage any of our viewing and listening audience, if you are looking for a way to give back that you can feel solid that 100% of what you're donating is going to a very good cause that has a very strong core, this is a good place for your money to land. This is a beautiful way for you to potentially give money that can save lives and prevent, cancer.
Yes.
I mean, because those pre-screens are so important. I appreciate your time today. I know you're very, very busy. You're probably trying to recover from the Pink Gala. So I hope you slept very, very well,
Yes.
because Amanda, apparently your job starts over and you're planning for next year already.
Absolutely.
We've already had conversations about it. So thank you, and we hope to see you back on the show soon, and I look forward to seeing all the progress and the new things that the foundation will have to offer in late 2026 and on into 2027.
Thank you so much.
Thank you.
You've been listening to Today in Putnam County. I'm Shan Stout. I'd like to thank John Bell and Amanda Scott with the Cookeville Regional Foundation for being our guests today. And until we see you next week, enjoy the journey.
This has been Today in Putnam County with Shan Stout.